U.S. health officials declare a public health emergency after a coronavirus outbreak. There are now 8 cases of the deadly virus confirmed in the U.S. It's killed more than 300 people, and then thousands others are sick. But local health officials are saying that Ohio is considered to be low risk for this virus. Here to explain why that is, Dr. Amy Acton, the director of the Ohio Department of Health, with us. Glad that you came on today.
Thank you for having me.
There is a lot of fear around this virus right now. So explain exactly what it is, what we need to be looking for, and the reality of it.
Right. Well, first of all, I want everyone to know that we stand ready. This is something that public health officials, I as director of the Department of Health, work with the CDC every day. We've been following this all along. And we have a whole army of local health departments, hospitals, universities that are planning and always vigilant for this. So it is a severe illness, as we're seeing around the world. Coronavirus is actually has a family of viruses. We've seen it before in SARS, we've seen it with MERS, and these viruses are new. This particular strain is new. It came from animals to humans in China, but is now, as we see, starting to spread around the world. However, in the United States, we have 8 cases. In Ohio, we have no confirmed cases. So right now, in Ohio, we are very low risk, but we are watching and we're vigilant.
Because as you remember, last week we reported 2 possible cases on the Miami University campus. Those have not been confirmed at this point. And from what we've seen, these have all been people who have been in China or have been in close proximity to those who have been in China.
Right. The people that we're talking about are 2 students at Miami University. They had symptoms of a viral infection when they came back from recently traveling. And so the university has been wonderful. They have been self-isolating, and we're still waiting for the results.
And everybody diagnosed, are they going to get sick enough to be sent to the hospital? Or can some of them, because it sounds like they're flu-like symptoms, are some people okay to be at home and to get past this with their own immune system?
That's right. You know, it is an evolving understanding of the science at this point. Most of the deaths you see right now have been in China, and they have been in the elderly or folks who are immunocompromised in some way. Very similar to the flu, people are more susceptible, but many people are at home, including some of the cases.
And the flu, I mean, that has a vaccine to protect you against. Coronavirus, is there anything there?
There isn't, and unfortunately it will take at least a year before there would be a vaccine, although our technology now, we're able to move a lot more quickly. But that's why we have to be particularly careful. But for people at home, what I want them to know is your routine, the same things you would do for the flu. At this season, we know we have a very heavy flu season. We have a lot of folks sick with the flu here in Ohio. So washing your hands, it sounds boring, but I keep saying it is so crucial. If you don't feel good, stay home. You know, we always say stay home, talk to your doctor. And sneeze and cough into your sleep. Those are the precautions that are most important right now for Ohioans.
And I think sometimes people forget how severe the flu can actually be because we have this vaccine, so people maybe are, you know, less susceptible of getting it, obviously. But we report on deaths every single year of the flu.
That's right. You know, last year in the United States, 35,000 people died from the flu. And we already have had over 8,000 hospitalizations in Ohio this year. So the flu is much more something we should be aware of, and the vaccine is out there, and it still matters to get it. So get your flu shot. It won't protect you from corona, but it will protect you from the flu.
And if that's not perspective, 35,000 deaths last year in this country, or in Ohio.
I know, in this country, thank you.
For a second, okay. In this country is just, it's remarkable. The deaths of coronavirus up to 300, which is not something we'd like to see, but it just goes to show things that we all need to be watching for.